So, there's been a recall of a very commonly used psychiatric medication called clonazepam. We're going to talk to you today about what you need to know to make sure that you are safe and some additional information for how to check if this applies to you. I'm Dr. Nichelle Haynes,
I'm Dr. Kristin Lasseter,
and this channel is Medical Mamas. We give you the real deal information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Based in science.
So, the information we're about to give you is not something we got off of like the news or anything. This is from the
Mhm.
FDA.gov's website. And so they're in charge of, regulating different medications that go out and making sure they contain what they say they contain and also contain the dose that they say they contain,
Yeah.
which is what has happened here with clonazepam.
Right. So we want to be really specific. This is clonazepam, the oral disintegrating tablet. So if you have the regular tablet that you swallow, this probably does not apply to you, which is great information. The oral disintegrating tablet is really useful for a lot of different scenarios. I think it works a little bit quicker for people who have trouble swallowing pills, especially young ones. We utilize this medication for seizure disorder. We also can use it for things like panic disorder. Occasionally, we can use it for things like insomnia. What else am I missing?
Anxiety
And
for
yeah,
some
just like
people when they're
generalized
having
anxiety.
acute anxiety.
Yeah.
And so, what happened here is that there's a specific company called Endo
Mhm.
that is I guess, puts out the generic brand called clonazepam,
Mhm.
and they use a third party packaging company to package their medication that they send out. And the third party packaging company messed up the dose of what's labeled on the package. It doesn't match what's actually inside in terms of the medication dose.
So I think it might be helpful to have some context here, right? So this isn't like a pill bottle that you get, like that you're thinking of, right?
Mm-hmm.
So it comes in a box. On the outside of the box, it says clonazepam ODT, which is oral disintegrating tablet, and it has a dose right there. So that dose on the outside of the box that people get when they get this prescription does not match the blister packs. You know what I'm talking about? The ones you all push
Yeah.
through,
And
right?
it's not for all of them, it's for specific lot numbers that
We'll include that
were
in the show
were
notes.
an issue. And so maybe we can show a little picture right now of where
Hmm.
you can find this lot number. So
Hmm.
you can find it inside on the blister pack.
Hmm.
And the blister pack is correct. That will say the correct dose, but
Right.
still, just to be safe, if you got one of these medications with this lot number, it's better just to throw it out or get rid of it in a safe way.
Mhm.
And then also, if you've taken one of the medications that were listed in these lot numbers, then call your doctor and make sure that you're doing the right things to stay safe because bad things can happen.
Right. So the concern that I would have in this scenario is if someone was taking more than what is prescribed, that can have side effects initially, right? So if you're taking a little bit more than you thought you were taking of this medication, you could be a little bit more sedated, you could have a more intense response. It can kind of make you feel a little loopy. There are things that can happen there. So that's one concern that we would have. We want to make sure you check the lot number and you're taking the appropriate dose for you. The other concern that I would have is if someone has been consistently taking a higher dose of medication than they thought they were taking and abruptly stops it or, goes down really quickly, that can be really serious. So we definitely want people to be looking at and knowing exactly how much they're taking. And that's where the real concern is here is people were taking more than they thought they were. So if you're taking less than you thought you were, it's probably not a huge problem in most scenarios here.
But either way,
But
reach
either way.
out to your doctor and let them know and check the lot number for your clonazepam medication if it is the disintegrating one. So,
Right.
so far, this does not apply to just regular clonazepam tablets that you swallow.
Right, right. And I think that's reassuring. I don't use the oral disintegrating tablet too much, but I think maybe there are cases where they're really appropriate. So if you have the oral disintegrating tablets of clonazepam, check your lot number, talk to your doctor. You can always reach out to your pharmacy because they should have record about which lot number that you had if you need to clarify or something like that. So that would be one way of addressing the situation. So I would definitely take care of it if that's a medication that you're on.
Yeah.
Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.